Okay, so we're reconnected. I'm glad I was able to reconnect. I was afraid I was going to have to relaunch the whole program. Thank you for staying with us. Those of you who are with us, I don't know what happened, but we lost our internet connection. Sometimes when this does happen, it kind of gets crazy and does it again. So if we get cut off 2 or 3 more times, we'll see what we got to do. But I was addressing the doctor's question about him being uncomfortable, and I was saying that sometimes it depends on the intensity of the machine when it was used on this type of situation. It depends to deal with the length of treatment, which I don't know, which he didn't share. If he was treated for 45 minutes on a moderate setting, he may have gotten more than he needed for that particular day, and so the next day it kind of reverted back to the thing that it was. So that's a question that you want to talk about with your folks. Number one, you want to make sure that they're comfortable. What I do when I treat somebody, and I'm treating a gentleman or a woman, and I take on up, I'm beginning to turn the machine up a little bit, and I say, is that plenty? Is that enough? And they'll say, yeah, that's enough. I turn it down a little bit. Oh, that's fine. Because what they're saying sometimes is, oh, I can take that. I don't want them to take it. I want it to be enough energy that's going to go deeply into their body and help them feel better, but it doesn't have to be enough energy that it's like a deep tissue massage the next day and they're sore before they're better. The other thing that you need to deal with is in some situations, and my wife's situation was like this when she had her herniated discs, and with some folks it may take 3 or 4 treatments depending on, again, what's going on with the indication to really get you to where you want to be. So my question would be, make sure the machine is on a very comfortable setting. You don't spend any more than 8 to 10 minutes on an area of treatment. In some cases you could do it twice a day, but you don't spend more than 8 to 10 minutes. And then you do it as long as function continues to improve. I can't tell you, I can sit back and say, doctor, that how to test to see if someone is a good candidate. The quickest way would be if you put it on them and they were uncomfortable from the get-go at any setting, I would say, this person could have a adverse reaction to this type of signal in what we're doing and how they're accepting it. Would be the only way to test, because 99.9% of the people sit down, put it on, treat them, and most of the time they'll get up and their pain will have improved from a 10 to an 8 or a 10 to a 5, and they're better. It's not 10 to 0. Once or twice I've had that over the last 12 years, but not very often at all. So it's very difficult to see if you test for someone if they are a candidate unless they just can't be around it at all. And again, that's the person that can't be around high voltage wires. The microwave drives them crazy. Being in front of their computer after a period of time or watching their television just makes them uncomfortable. There are different sensitivity levels to those types of fields that are out there that we have to deal with on our daily lives. But I would ask those questions of you, and if you want to call me, I'd be happy to discuss that. If you want me to discuss it with the practitioner, I would be happy to do that as well. But that does not mean that you're not a candidate unless it is a toxification issue and you need to get detoxed, which this will do. There are many cases that you're working with someone and they start detoxing immediately and they're uncomfortable. And once they get detoxified to a point that they're not over detoxified, but they work on their toxification levels, then they become more comfortable and they attain the results they want. You see, it's much more than just this machine. Diet plays a role in it, toxicity plays a role in it, activity plays a role in it. You know, it's not we had an issue several years ago when we were talking in the athletic world and in the horse world, talking about, oh, it's an analgesic and you can do it, and then the horse can go out there and go right through it and hurt itself. No. If there's a problem going on and it's still there after you treat, it's going to still be there because you're going to strain it. If an athlete goes out there and got a bum knee and you treat it, and that's feeling pretty good, and he goes back out on the field, and then all of a sudden, a couple plays later or 5 minutes into the match, it's back because it's not an analgesic. If the body's got something going on, it'll come back. If it can deal with it, this helps the body deal with its flexing, with its range of motion, with the inflammation. Then it'll help in that regard. So I hope that answers the doc's questions. If any of you have any questions about that or anything, I'd be happy to take a look at them. We are back. Let's see if there's any questions here. Nope. Let me go to the questions that I have here, and I'll go on to the next one. Okay. All right, I had someone approach me this weekend at an event saying her osteopath claims that there are studies out showing that having the wings laid over a horse's has negative effect on the lungs. To me, this makes absolutely no sense on a scientific side, but has anybody else been questioned about this or know any reports out there? I told her I would do my due diligence and follow up with her question, but can't find any reports on negative effects on the lungs in general, let alone the equine lungs being affected by the wings. Well, so what I've learned over the years, when someone asks a question like that, yeah, there are studies out there that this is bad or this does this or this does that. My answer to those questions is, can you provide the studies? Would you tell me where they are? Or tell me who told you that so we can ask them, where are these studies? Typically, that stops things. So someone is, and kind of like the comparison I was using earlier in the program today, talking about the low power, and their defense was MagnaWave shocks the blood vessels or shocks the blood cells and to bring them to life. That's what someone says. So someone's going to say, yeah, there's a study out there that says MagnaWave shocks, but it doesn't. It provides a magnetic field to the body to enhance the healing process. So someone somewhere who doesn't have wings, I would think, has said, oh, there's studies out there that show this does that and this, that doesn't work and mine does it better. And they're all good. I mean, I'll be the first one to tell you that PEMF therapy, MagnaWave PEMF therapy is beneficial. Other forms of PEMF therapy are beneficial as well. To me, the secret is the depth of the family that you're dealing with, who knows what they're talking about, who has a good support system, how quickly you need to get a result with what you're dealing with. People want instant results, and that's what, from the day I started, I'd put it on a horse, or I'd put it on a person, and they'd go up and they'd feel better, and they'd say, okay, do my horse. They'd get on the horse and ride off and come back and say the horse is better, and away they would go. So, people are looking for various reasons. There are plenty of people out there using low power blankets and things like that comfortably on their horses, doing it every day for 30 minutes to an hour a day, and that works in their regimen. More power to them. But that's the difference in the situation. If you sat down and looked at it, there's only a couple of our companies, a couple different companies out there, competing companies that have the wings, and they've only had them for a couple of years at best. And to have a study for someone, to be very candid, for someone to do a study on how the wings interact with the lungs, to spend the money required to do that study is incredible. And so I doubt very much if someone has done a study to reflect that. Could a study be done at some point along the way to see how the overall treatment of the body? I mean, there's plenty of studies that have been done with various blankets and various large rings near a horse, on a horse, to enhance its health and wellness, or a person can wear the wings over their back. There's nothing going on with this signal being delivered to the body that would be that we're aware of that would be contraindicated for the lungs. You can put the coil on your shoulder, you can drape the coils over your shoulder, you can put the front and back, you can have a coil behind you. I'm talking about a large coil now like you'd have with the wings, and have one on your chest, or have one on your lower abdomen area and one on your low back to work both directions. There's no reason to find if there's any indicated issue there. And so that's, it's just amazing where this stuff comes from. And so, to find supportive studies to that end as well. And I had an issue with the FEI years ago, and they were trying to compare us to Shockwave, because someone made a comment like was made earlier that the MagnaWave shocks and this machine shocks and that machine does this, and the FEI said, oh, it's like Shockwave. That's what somebody said. And they came to me, because I was the one interviewing with the FEI and showing and demonstrating the machine and what they came back with. And I went to Dr. Pollack at Johns Hopkins when he was and in his practice, and he said, what they're asking you to do, what they're asking you to prove, that this won't do is would cost you more than if you did what people spend to have drugs approved, to have medical devices approved. We're not talking about hundreds of thousands of dollars for you to come back with this detailed information for them to allow you to use this equipment and in FEI. And they said, oh, we're going to not allow it to be used. Well, that never happened. Why? Because PEMF therapy in Europe is an accepted, daily used, human used therapy in Europe. Has been for a long time. And in the United States, the modalities are becoming approved all the time for various indications by the FDA. I've got a video that I played, and I'll play it again here, but it shows all the different areas where the modality has been approved by the FDA. And we're in the stages now with our final 3 studies actually nearing completion as far as the study portion now. We have one at the Henry Ford Hospital in Detroit. You can go online and search PEMF studies, Henry Ford Hospital, Detroit, and you'll see it. It's an ongoing, almost completed study. The other one at the Palm Beach Veterans Hospital in California for bed sores. The Detroit is venous wounds, and then at the University of Miami in Florida, we're doing a study dealing with inflammation, arthritis of the knees and elbows, inflammation and pain of the knees and elbows. These are studies that us and our associates have funded, and the factory or the manufacturer has funded, and going forward to be able to present to the FDA and to present to foreign countries countries to gain approval there. We are CE approved in Europe at this time for human use. All of our devices are safety cleared, meaning they passed UL type of safety clearance for safety of use, which has to happen if you want to export a device for human use out of the country. You have to be safety cleared in order to do that. We have CE approval now in Canada for Health Canada. All we're awaiting there is the final factory inspection. They made some changes in the international rules that required all of the factories in the United States who have CE clearance into Canada be certified at the factory level, that their factories meet the FDA requirements or meet the requirements that they require for a U.S.-made product to be exported to their country and have CE approval. You'll notice that most of our competitors, and I'm not throwing anybody under the bus, don't have that. They don't do that. They're not spending the money to do that. They don't have the safety clearances, and they're not working to be FDA approved in the FDA approved, cleared, whatever word you want to use, in the United States. And that's something that we hang our hat on and want to do and want to deliver to you. Hope that helps there. I kind of get rambling. I don't want to say I get rambling, but it gets me going and I get excited and I want to talk about it whenever those questions come up. Let me see if there's any other questions here. No? Okay, so let's see. I'll take a look here, and here's Elaine on the phone. I wonder what she's after, but I'll have to talk to her in a little bit. She probably forgot that I was on the air. Elaine, if you'd like to call me on the air and talk about something, it's 502-599-9722 if you're watching. I'd be happy to discuss it with you if it's to the program. If not, I'll talk to you here in a few minutes. Okay, there was another question about IVDD, intervertebral disc disease, and they were asking, will MagnaWave or can MagnaWave be helpful in that type disease? It's quite prevalent in dogs, and it's a debilitating disease of the cartilage in the spine, and it causes inflammation and bumps and causes things to break down. A lot of times it's compared to a herniated disc, but the issue becomes, in the past, it's been dealt with steroids, which a lot of times you don't want to get into continual use of steroids. Surgical procedures have been associated with taking care of it, but a lot of times with the information that I've read, that causes problems of its own. But basis of the disease is things become inflamed. They have inflammation. It starts locking stuff up. starts messing with mobility and a paralysis type of situation. And I said the key word there a moment ago, inflammation. So they'll use NSAIDs to control inflammation. They'll use steroids to control the inflammation. Will MagnaWave be beneficial to that inflammation? Well, it certainly could, because it's an inflammation reduction device, and if it's used on the body or over the spinal area, it could very well not necessarily reverse, because once things get in control, it depends how long this has happened. If you haven't, and they talk about that, if you have an animal that is subject to this and is going to potentially take on this disease or have an issue with this disease, you need to start treatment. You need to start making sure it doesn't have inflammation. And that's the same thing with us, and we've experienced that quite often with dysplasia, with hip dysplasia. If you catch it soon enough that it's starting to develop and you keep it going, you keep everything nice and tight in the muscle area of the horse, you keep or the dog, you keep the inflammation down, then it doesn't have those problems. We had it with our boxer for years. That the boxer had a horrible hip dysplasia. And the issue was, well, you're going to have surgery, and then you got to carry it around, you got to do all this kind of stuff, and then you got to have probably the other hip done. Well, it's the same thing with IVDD. Once it's there and you're working on it, it's a perennial type of situation, unless you can find something to control it, and unless you can catch it early enough to kind of control it. And that's where we, with our inflammation reduction possibilities, can be beneficial to those types of things. And if you're looking for that and you want to know as you're dealing with particular diseases and you look them up, or you're looking for, can this bring comfort to someone who is having a problem, and you look up what their problem is, and if inflammation is part of their problem, can we potentially provide comfort? I would think so, or that's possible. And so those are the things. Inflammation is the key to most all pain in one way or another. As you become inflamed, you have pain, things get, eruption occurs, and bingo, you have those types of situations to deal with. So that's the question on the IVDD. Can it be beneficial? And it may be, because of the potentiality of inflammation reduction. So, any questions, please post them in the chat box. We've been going for about 35 minutes with about a 5-minute break in there to get us back on the air, and I'm glad that you're with us. Looks like most people are back, and I would be more than happy. If you have a comment on one of the questions that I've answered, or if you have a little deeper answer that you'd like for me to potentially project into one of those questions, please post it here, and I will be more than happy to approach it. I just don't want to sit here and babble about things, but I do want to answer the questions that you may have. There was a question this morning posted in the Facebook group about bone healing, and what about bone healing, bone regrowth, that type of situation. And I found a study that dealt with that, and it showed that the pulsed electromagnetic fields does enhance the growth and the healing of the bone in those types of situations. And I posted that on the Facebook page. We'll also put that into the two groups, the MagnaWave Practitioners Group, and to the International Resources, MagnaWave International Resources and Education Group, which, if you go there, you can go to the MagnaWave. Let me put it up here. Here we go. It's the MagnaWave PEMF International Resources and Education Group. It gives anyone as a interested party or interested person to go to the group and search for a particular indication or a particular thing, and what's been found about dealing with those issues is available in that group and shared in that group. So it's a great place to go learn and learn more about PEMF and about MagnaWaving. On the MagnaWave page where we talk about MagnaWaving, you can't search. So we can post information and it's there, and we do our best to post information all the time that's beneficial to the learning public, but it can't be searched. That's why we have the international page where you can go and actually search for something to learn more about what we're doing and how we approach it to get better education, because that's what it's about. To me, that's what it's about. You want to find yourself with a group that is going to support you, that is going to have the education, that's going to be doing the research to help you along and help you better understand, help your clients better understand what you're doing and how you're aiding their health and wellness. Whether you're a doctor can approach it a lot differently. A doctor can go in and actually diagnose with the equipment, understand what's going on, approach a specific indication. General practitioners can't really do that. They talk about healing and wellness and how we can proceed from there. So a lot of that information is at the MagnaWave PEMF International Resources and Education Group. So go check that out and be able to get after this. Now, with the question of bone healing, I'm going to, this afternoon, have a live cast on Facebook, and I'll also put this into the groups, but a live cast on Facebook of a presentation that was made at MagnaCon by Dr. Amanda Myers and Verlinda Thompson from Texas about Verlinda's horse, Amiga, who suffered a very catastrophic injury to its coffin bone and foot area, to the point that, I mean, the pictures were incredible, but to the point that everybody, the attending veterinarian, her father, Verlinda's father, who is a veterinarian, wanted to put the horse down because of the pain and the fact that the horse would not recover. And they made a presentation documenting the entire recovery with x-rays, with showing how they treated and what they did, and the results were absolutely amazing. And I'll be having that replay of that particular presentation this afternoon. I believe I'll do it around 2 o'clock live on Facebook. So tell your friends or come see us. It'll stay there so you can see it. It'll be posted there, and then it will also be available in the MagnaWave PEMF International Resources and Education. So it's really an interesting video for anybody. I sent it to, I had a professional football team, and they started asking me, what about bone healing and that type of stuff? And I sent it to them, and I said, look, a body's a body, and blood is blood, and health is health, and bone healing is bone healing. Look at this and see what it did and see how it works, and you'll better understand that. And like I also posted, there are studies that will support and go back up, will back up the potentiality of bone healing. And there is an FDA-approved device. The modality is approved by the FDA for bone healing. It is a specific device, and that's how the FDA works. They approve specific devices for specific things, just like the studies we're doing, 3 different areas that we're looking to have support in to be able to market to those particular areas, or to understand that this device will do this for these particular types of issues. So that's where we are there, and this afternoon I will play that video for you. It is absolutely incredible, and I think you'll enjoy it very much and use it as you can. All right, any other questions? We're about 40 minutes in at this point. I'd be happy to answer any other questions that you may have. Just put them in the chat box. I'd be happy to answer them for you at that time. If not, then we'll get ready to head along, and I've got another meeting here shortly in a few minutes, and Lane's looking for me for something, and we need to make sure we stay on top of that stuff. So it looks like there's no questions at this time. So listen, thank you for joining me. I really appreciate you being here. If you have any questions that you'd like for me to approach, like the doctor did and with his questions, so he could see them on YouTube when he goes back and checks out the YouTube channel. If you're not a subscriber, go to the MagnaWave YouTube channel and subscribe, and that way you'll be notified when various videos that we put up and the information that we put up is there for your learning and information. So listen, thank you for being with me. I really appreciate it, and we look forward to seeing you next week. Have a great day, or this afternoon. I'll be back this afternoon at 2 o'clock. Have a great day. Bye-bye.